We'll take a few questions, please, in an orderly manner. And
we have approximately 15 minutes for Q&A, so one at a time. Yes? Right here.
So can you explain how this food distribution is going to work? You talked about DoorDash or whatever. How is that going to work?
Yeah, happy to explain more in greater detail. It's fair to say that we are moving at the speed of the information we're getting. And I think for cities and for nonprofits throughout the valley, we're all going to be setting up these systems in the next hours and days. And there are a lot of folks who are working triple overtime, including Dawn Beckles here in the back. And they are working on setting up those systems now. So we'll certainly have more to announce in the days ahead.
But basically, it's just going to be like a DoorDash, companies like that, to be asked to step in and deliver food.
We're going to need to rely on a lot of volunteers. We're going to need to rely on existing companies, and we're going to need to rely on existing CBOs, those nonprofits that have been serving the community and doing such an excellent job.
So, Mayor, as I'm sure you know, there have been food and supply shortages in recent days. People are going in, starting the day, cleaning out the meat aisle, the toilet paper aisle, the cleaning aisle. Is there any discussion of a system that you guys could create that's maybe smooth that out? Ration?
Yeah, as you know, many of the stores are already beginning to ration in terms of sales, and we've had some of those conversations with the county, and I expect that you'll hear more on that in the next day or two. We recognize that there has been a lot of fear that has driven consumer behavior that is not helpful. We want to assure everyone that all the food delivery systems that we rely on every day and have relied on for decades are going to continue to be in place. And so that no one should fear that they need to go buy everything on the aisle. There's going to be food, and we're going to push to make sure. We're also dealing, for example, we're understanding companies like Safeway may have difficulty delivering because of curfews on delivery. We're going to get those curfews out of the way. That's what it takes to ensure more food gets delivered.
Heard from several police chiefs that they have no idea what this is. What is the police chief?
Dave Sykes, City Manager. As the Mayor mentioned, many of us are responding to these orders, I think in a responsive way. Police departments ultimately would be responsible for enforcing some of these orders. I think it's going to be important that we don't rush to that enforcement, that we set up the systems and processes in place so that the community understands what's expected of them before we rush to enforcement. But ultimately, I think all jurisdictions will have that responsibility.
Yeah, along those lines, when you mentioned essential functions, without going into granular detail, can you explain what is essential? If you're speaking before a press conference with a bunch of newsrooms,
Yeah.
people are going to be out there and
Are you essential? Yeah, I think you are. Yes.
Maybe I'll take a first crack at it, and I know some of my colleagues may want to as well. Most of the mayors in the Bay Area are probably hearing about this for the first time in this news conference. So the implementation of these directives are up to each city and local jurisdiction. And we're going to do everything we can as the largest city in the region to flesh out as much as we can in a very public way for other cities to adopt if they find that helpful. But it's fair to say we're simply getting these directives in real time, and we now have to translate them into very specific orders. And obviously, our police department is not going to be out there enforcing at midnight tonight. It's going to take some time for us to get the systems in place, to get the rules in place, to ensure everybody understands what the rules are, and then to enforce as if it's really appropriate. We expect most folks will be following the direction without the need for law enforcement.
Go ahead. And can I ask Sheriff Smith, if you don't mind coming up here?
So I just wanted to add a little bit of context to what the Mayor said. Many cities have been planning for this and understand that we are going to be at a point where we're going to be providing essential services. The orders that have been issued give each city a fair amount of discretion to determine what that is for each city. I know in our city, the city of San Jose, we've done quite a bit of work and a lot more detail will be coming out. But I want to reassure you, it is more than just police and fire. There are many essential services that are needed to keep a city running in a safe and orderly and healthy way. And so more detail will be forthcoming, but I want to reassure you, it's more than just police and fire. It's much more than that.
No, I just brought her in case there was any more questions.
So you've seen this slow ramp up of measures going into place over the last couple of weeks. You said that this is a more difficult decision to make than the announcement that you made on Friday. Can you tell us, was there anything in particular, a tipping point that's taken place between here and there to make this necessary?
Thank you so much for that question. As I said in my remarks on Friday, we were seeing a tipping point here in Santa Clara County with exponential growth of our cases. We've also looked at the acuity. A number of our cases are hospitalized and some requiring intensive care. Over the weekend, I had a discussion with fellow health officers in the Bay Area, and we were looking at trends and realized very quickly that we are one region, and that's what's happening in Santa Clara County today, where we're the epicenter, will soon be happening in our adjacent the adjacent jurisdictions. We decided collectively that we needed to take swift action as soon as possible to prevent the further spread and to protect our critical healthcare infrastructure. These orders were crafted with great thought and with great care. They were also crafted very, very quickly. We thought of everything that we could. Our intent is to preserve essential infrastructure, to enable people to get food, get medicines, to enable people to telecommute, to enable the businesses that support all kinds of core infrastructure to remain operating. At the same time, we are also trying to maximize social distancing to the greatest degree possible because we know that this is moving so fast and we needed to take very, very swift action.
Is testing being ramped up? Is there an update on testing also for the jails? Is there any update on the cases inside the jails and their function?
I can tell you that testing has begun to accelerate. There, I believe, as of today, a site has been stood up, one in Santa Clara and one in San Mateo County. A number of commercial laboratories are coming online in addition to the academic laboratories. So yes, that's beginning to ramp up. And as I mentioned in previous remarks, once we expand testing, we'll be able to identify and report more cases, so our numbers will increase rather dramatically.
Can you elaborate on what ramping up this means? Like on what scale it becomes?
I can't give you numbers because I don't have them about the quantity of testing available. But what I just want to emphasize is that testing is now become decentralized. Prior, it was done just within the public health laboratory system, and now it's across the commercial and academic sector.
How has the spread impacted healthcare workers who may have been exposed so far? And is there a plan to make sure that we don't have any shortage of healthcare workers as they're dealing with the virus?
That's an excellent point. One of the reasons that we need to slow the spread of this infection as quickly as we can is to protect healthcare workers. Healthcare workers are also residents in our community who are at risk of being exposed to the virus just as we all are, in addition to in their workplace. So we have had a number of healthcare workers infected. I don't have the exact numbers. That is happening here in our county and in many other communities, and that is one of the many reasons that it's imperative to slow the spread and preserve the workforce.
One more question here, then.
Yes, for the jails.
Yes, very briefly, we had 2 exposures in the jail. They were immediately isolated. We had 2 additional exposures. We have no confirmed cases in the jail at all.
Thank you, sir.
For Dr. Sarah, I know it's a lot, but can you try to include some of the key points in Spanish or Spanish here?
Maybe after.
We have a Spanish speaker ready to do interviews after this press conference. We have this question over here and then that speaker.
So Dr. Curry, you talked about the number of patients requiring hospitalization and acute care. Can you get into any more specifics or how close we are perhaps to the system being overwhelmed? And can we get, sort of that daily data on, some kind of graph that shows us if these measures are beginning to suppress the spread?
We very much want to provide as much data as we can to the public for a number of reasons. In part, we want you to understand why we are taking the actions that we are. It's more difficult than it would seem to classify the cases by whether they're in the hospital or at home or in the ICU. And the very simple reason for that is because the case status changes. People are moving between between home and the hospital or between the hospital and the ICU. And so we're trying to figure out how we can make those data accurate and useful. But big picture, right now, the acuity of our cases is rather high. That is because we are doing more testing in the hospital at this moment than we are in the outpatient setting. So as we progress and testing expands, I think those proportions will change. The proportion of patients in the hospital will shrink, and those who are isolating at home will grow.
And limits on travel. I don't know if anyone's addressed that. I mean, can people get their car and drive where they want to go? Can they hop on a plane if they have an existing reservation? We haven't really talked about travel.
I will try to give you a high-level overview. The order restricts non-essential travel. So you may travel by public transportation, private automobile, or an airplane to perform essential functions for essential services or essential businesses. The idea, though, is to limit it as much as possible. The whole idea behind this is to have people remain in small, stable groups and to limit mixing to the greatest degree possible.
Mayor Liccardo, can you make a general statement to the Spanish speakers community for the standpoint that are watching live on our national?
Sure.
We
I
have
think
the
you
Spanish
probably.
speaker available after
Yeah.
the press conference to be on camera.
Okay.
I'm happy to give a statement after that, but I think probably best to have county officials or experts to give that statement.
Is there priority testing for public safety, or they get in line like everyone?
As testing ramps up and as testing is still limited, we have had to include some priority groups. And the broad outlines are, and this is both for testing as well as information that we're going to get with tests when it expands. It's very important to us to know if someone is positive and they're performing an essential role because that's of public health importance. That's just the general outlines, because remember, our goal here is to limit social distancing at the same time that we preserve essential functions and essential services.
Okay.
Yes.
Any last question here?
Dr. Brooks, for you, Dr.
Sorry.
We've got a lot of people that contact the station saying they're sick and they have symptoms, whether it's a high fever, a cough, etc. It's unknown whether they actually have CB. Maybe they haven't traveled abroad, or maybe they haven't had direct contact with somebody who is tested positive. They're telling us that they can't get tested for it. They feel like they want to be able to get tested for it. What's the position from the health professionals on this? If you have exhibit symptoms, should you be able to go in and get tested?
So I have a very, very important message. If you have symptoms of fever, cough, shortness of breath, or any of those symptoms of getting a viral infection, and they're much the same, right, at the beginning, you must stay home. Even if you're, and most especially if you're an essential worker, you must stay home and self-isolate and not spread. As testing ramps up, It will be, it's not possible now for everyone with symptoms to obtain a test, but over the, with every day, the testing capacity expands. So people will be able to get tested and know whether they have this infection or another one. But for now, for example, the time between getting a test and receiving a test, it's not right away. It may be several days. It's incredibly important that people self-isolate to not spread their infection. That is key, absolutely key.
But there is a plan at some point to test people who exhibit symptoms. They don't know if they have CV or not. It could be something else. But there's a plan to have them tested for CV. And if that is true, when would that kick in?
So, as I have mentioned before, we are trying to scale testing through commercial laboratories and academic laboratories. As testing scales, more and more people with symptoms will be able to get tested and confirm their infection. But in the absence of being able to confirm an infection, anyone who is ill needs to stay home and to the extent possible away from other members in the household where they live.
Yes, thank you, everyone. This concludes our press conference for today. We do ask the press to refer to the FAQs that have been produced for y'all today. And we do have county representatives to speak on camera in Chinese, Vietnamese, and Spanish. Thank you.
Okay, the news conference there is wrapping up. This is in Santa Clara County. 7 million people across the Bay Area, 6 Bay Area counties, including Alameda, San Mateo, Contra Costa, Marin, San Francisco, Santa Clara counties, and the city of Berkeley, all advised to shelter in place. This map really looks over the areas that we're talking about here, all to prevent the spread of the coronavirus. Marcus, I know you've been listening in as well.
That's right. And I think one important thing that I heard was when someone said collective action is powerful. And that's what they're saying. Everyone work together, because what we want to do is prevent the spread of coronavirus. We've seen such an outbreak here in the Bay Area. So many people affected. 273 confirmed cases of coronavirus right here in the Bay Area. And they said they've looked throughout the country, throughout the world actually, looking at what's been happening, the trend that we're seeing when areas are dealing with coronavirus. And they say that shelter in place is really one of the best ways to prevent the spread of coronavirus. But during that time, I know a lot of people, this will be scary for a lot of people as you're not really sure what to do, where you can go. But this is important to know that there will be services that will continue. You have many services like the transit that will stay up, and they're asking only people who need to get to work or essential places to use that transit. You also have the garbage. You have takeout. Restaurants are able to deliver to you as well. And the grocery stores are open, and that's one important thing, because we've seen so many people recently in the past few days rushing to the grocery stores to try to get essential items. But those grocery stores will remain open, so you don't have to rush out. But we want people to be informed about what's going on, because that shelter in place will go in effect at midnight tonight, and it will last until April 7th, which is going to be about 3 weeks. So it's something that we're all going to have to deal with as we continue to figure out how to deal with this and hopefully stop the spread of coronavirus.
Very much so, very much so. And let's talk about those essential services that we're talking about, okay? Of course, police, fire, hospitals, healthcare facilities will remain open. Pharmacies, you'll be able to get your prescriptions need be. You mentioned gas stations, banks, they say hardware stores, grocery stores. People will still be able to get food. They're just asking people to shelter in place. Get what you need. Food delivery, as you mentioned as well, will remain as well. Restaurants, you probably won't be able to go there, sit down and have your meal, but you could call and take it to go as well. So these are some of the essential services. We, of course, here at NBC Bay Area will continue to give you all this information that you need, but this is in the county's best interest. All these different counties, really the entire jurisdiction, 7 million people in the Bay Area affected by this. We heard the county health director there say, we're at a tipping point. That is why they needed to make this decision. It is for the safety of all.
Yeah, and you know, Laura, when we were listening earlier to the president's press conference, they were talking, there was Dr. Deborah Birx, and she was actually talking about the importance of self-containment at this time, and they were suggesting 15 days throughout the country, but right here in the Bay Area, why it's so important for these 3 weeks. She says that if you imagine someone in a particular home, if they have the coronavirus, their confirmed case, if they stay in that home within 15 days, they prevent the spread to anyone else from that home 100%. And that's what we want to prevent, that spread from continuing throughout the Bay Area. Every day we're seeing these numbers go up more and more. And that's why it's so important for people to listen to what the officials are telling us right now, because they know what's going on. They have studied not only what's going on here in the Bay Area, but what's going over in Europe, where we've seen they've been under those same mandatory shelter in places to prevent the spread. And they say when that happened, we saw that number go down. And that's what we want to see right here in the Bay Area. I know a lot of people have been talking about this. We saw it here in Santa Clara County, as well as in San Francisco, where Mayor London Breed was also talking about what's going in place there in the city. We know Tom Jensen, he has been live there in San Francisco. He has been listening to what the mayor was saying. So Tom, talk to us about the things that were going on there, because the mayor was talking to the people that live in San Francisco, but this is something that we're seeing throughout the Bay Area right now.
It is, and you were talking about how they were looking at models from around the world, looking at China, looking at Korea, and how they were able to flatten that curve of the new cases that was so steep once they put everybody into lockdown and all the